Hello, everyone. My name is Rolando Perez, and I'm a member of Group 14 for the One Health Public Health Applications class. And today I'll be doing a presentation on COVID-19, and I will be the Minister of Health. To go a little bit over the background of the presentation, on December 31st, 2019, China announced a cluster of pneumonia illnesses among people connected to the Wuhan Seafood Wholesale Market in Wuhan. Chinese health officials said on January 7th, 2020, that this cluster was linked to COVID-19 nCoV, a new coronavirus strain. It's now known that the virus is spreading from person to person, despite the fact that it was initially thought to be related to exposure to a seafood market in Wuhan. The first confirmed case of COVID-19 infection in the United States was reported on January 20th, 2020, and as of January 30th, 2020, a total of 9,976 cases have been recorded in at least 21 countries. As of April 24th, 185 nations have reported more than 194,000 deaths and almost 2.7 million confirmed cases. By June 5th, 210 nations have reported more than 6.75 million confirmed cases and more than 393,000 deaths. Global measures to stop the transmission of COVID-19 have been made as a result of its rapid proliferation. To stop the virus from spreading, some nations have put in place measures including travel bans, lockdowns, and social distancing. Protecting the health and safety of our population while limiting the negative effects of our economy is my primary goal as the Minister of Health. To stop the spread of COVID-19, our government has taken preemptive measures. We have put into place measures like required mask use, stepping up testing and contact tracing, and setting social distancing rules. In order to be ready for any sudden increase in cases, our healthcare system has also been enhanced. The outbreak of COVID-19 is a significant public health issue that requires a coordinated global response. As the Minister of Health, I would like to outline the steps that our government is taking to address this situation. Step 1, collaboration. We are working closely with international health organizations, including the World Health Organization and the Center for Disease Control, the CDC, to gather the latest information on the outbreak and to coordinate our response. We're also working with our counterparts in other countries to share information and best practices. In addition to working with our international partners, we're also coordinating with various government agencies and organizations within our own country. And this includes the Department of Homeland Security, the Department of State, and the National Institutes of Health. Step 2, preparing the health system. We're taking steps to prepare our healthcare system to respond to potential cases of COVID-19. This includes providing training to healthcare professionals on how to identify and treat potential cases, as well as ensuring our healthcare facilities that have the necessary equipment and the supplies to respond to the outbreak. We're also implementing preventative measures. We're actively promoting preventative measures such as social distancing, wearing masks, washing hands frequently, and avoiding large gatherings. We're also conducting public awareness campaigns to educate our citizens on the importance of these measures. We're also working to increase our capacity for testing and diagnosis potential cases of the virus. This includes ramping up production of testing kits and increasing the number of laboratory equipped to conduct these tests. Step 3, educating the public. We're taking steps to educate the public about the outbreak and to encourage individuals to take steps to protect themselves and their families. This includes providing information on how the virus spreads, what the symptoms are, and what steps individuals can take to reduce their risk of infection. COVID-19 is a highly contagious respiratory illness caused by the SARS-CoV-2 virus. The virus spreads rapidly to respiratory droplets when an infected person coughs or sneezes. Symptoms of COVID-19 ranges from mild to severe and can include fever, cough, shortness of breath, and loss of taste or smell. We're also working to dispel any misinformation or rumors that may be circulating about the virus. This includes partnering with trusted sources such as the World Health Organization and the Center for Disease Control to provide accurate and up-to-date information to the public. Step 4, measures to contain the spread. We're implementing measures to prevent the further spread of the virus. This includes implementing travel restrictions and quarantine measures for individuals who have traveled to affected areas, or those individuals who have been in contact with someone else who has also been affected with the virus. We're using advanced technology to conduct contact tracing and surveillance, which is critical to identifying and containing the spread of the virus. We're also working to increase awareness of the virus among healthcare professionals and to encourage them to take appropriate precautions when treating who may be infected with the virus. Step 5, treatment. Our top priority is to develop treatments and vaccines to combat the virus. To achieve this goal, we're investing in and supporting research efforts to develop effective treatments and vaccines. We're collaborating with leading scientists and medical professionals to explore new therapeutic options and testing potential vaccine candidates. Additionally, we're working closely with pharmaceutical companies to ensure that these treatments and vaccines are manufactured and distributed as quickly as possible. We recognize that the urgency of this situation, and we are committed to taking a swift and decisive action to protect the public health of our country. Our efforts to develop treatments and vaccines are critical to ending this pandemic. We understand the devastating impact that the virus has had on individuals and our communities around the world, and we are working tirelessly to address this global health crisis. Through our partnerships and collaborations, we are accelerating the development and distribution of treatments and vaccines to those who need it the most. We remain committed to combating the virus and will continue to leverage all available resources to make progress in our fight against this unprecedented threat. In conclusion, the COVID-19 outbreak is a serious public health issue that requires a coordinated global response. As the Minister of Health, I can assure you that our government is taking this situation seriously and is taking all the necessary steps to protect the health and the well-being of our citizens. We will continue to work closely with our international partners to gather the latest information on the outbreak and to coordinate our response. We will also continue to take steps to prepare our healthcare system to respond to potential cases of COVID-19, to educate the public about the outbreak, and to implement measures to prevent the further spread of the virus. The end. Thank you so much for your attention.